A very good afternoon. I think speaking from this podium actually is a very humbling experience, especially to speak after the giants in ophthalmology, people who have been doing yeoman of service to Indian ophthalmology. So I think I'm here to share the small little story of organization called Sharpsight Group of Eye Hospitals. So we will actually do a flashback. I will share where we are today and then we'll take a flashback. I'm lucky to be born to a father who, apart from being a doctor, was an excellent poet too. So this is one of my father's poems. He used to say, "Manzil mil hi jayegi, bhatakte hue hi sahi. Gumrah to wo hain jo ghar se nikle hi nahi." So for people who don't understand Hindi, it means that you will find your destination one day or the other. The people who are actually lost are the ones who've never left their house. So keeping this in mind, we started our journey of Sharpsight. So this is what Sharpsight is there today. Sharpsight wants and believes in actually delivering. Our motto is patient delight. A happy patient is not good enough. The motto I give my team is, I want delighted patients. I want ecstatic patients. So the whole infrastructure, the game, is designed around making patients thrilled. Comfortable journey for the patient into the organization, within the organization, the experience with the doctors, the surgical experience is got one aim. We want smiling, laughing patients going out, and rest follows by itself. So this is a small video of how we work. So we have people who are engaging with the patients even while the patients are sitting, lest they don't feel ignored, they feel taken care of. Regular coffee, teas being served at no cost to the patient even while they're waiting. If the surgery is getting delayed, the organization pays for the lunch for the patients and their relatives. We don't charge money for these. Patients who are old don't have family members to bring them. We send pick up and drop facilities at our own cost. No added fees to the structure of the surgical fees. So this, I realized, was my market impact feature. This is what probably differentiated us from the other people in the private market, because patients somehow realized that we are out there to do something different. The best example is we will have patients who probably live nearby our hospitals but have moved away. They book a cab service and they still want to come to us even if they move 20 kilometers away from the organization. So we have actually realized that eye care actually is much beyond eye care. It is eye care. So once this message goes across to the patient, because patient experience is more than 60-70% of the eye care actually we deliver. Everybody is doing a beautiful clinical surgical outcome for these patients. So I feel in private practice what we can differentiate is by making the patients feel cared for, being taken care, being respected. So we have training programs, of course not like the stalwarts here. I do personal trainings, skill transfer of the counselors. Optoms, we have training schedules. We have online training, surgical trainings, morning huddles, twice to thrice a week, surgical mentoring trainings, CMEs. So this forms the whole structure of the organization. So we have a front end, which is a commercial organization. We have a teaching system. What we generate in the market is quality eye surgeons who will do great ethical practice once they go out. So we have a training protocol for young practitioners who want to set out to do practice. We give them basics of profit loss, AOPs, bank loans. So everything is built into the part of training for the doctors who join me, so that I probably am able to kindle that fire of entrepreneurship in the new people who join. So now we are coming up with the 15th center. So this is our center in Srinagar. This is Jammu. So now, after having some bouts of investments coming into my organization, we are going at a very fast scale. We're coming up with 20 more hospitals in next 2 years. We have a very, very rock steady team of back-end, telemarketing, social media, copywriters, quality control, mentors, HR trainers. With complete utilization of technology, social media, booking appointments, apps. And we are coming with a flagship center of nearly 45,000 square feet, new center coming up within the next 3-4 months in Delhi. So after this is the flashback. How did the journey start? And I'm happy to welcome Dr. Harbans Lal, who's one of my teachers and one of my mentors who's sitting in the front row. He's busy talking. So we started from a one-room clinic in my house. This is my ground floor. I have looked some photographs. We bought the first portable machine where I could make money by doing freelancing and shadow surgeries for people. So I would put this machine into my car and go and operate for various surgeons, doing shadow surgeries, making money from there to buy my own machine. So then I joined with my partner, and together we started having a dream to make affordable eye care, at least in Delhi NCR. We started with a small team of 2 optoms, 1 OT technician. Slowly, we realized that the power of media is very, very nice. So we started exposing ourselves to social media on the television, radio, and newspapers. Our first center was inaugurated by the health minister. This center was very small. This was a 2,500 square feet center. But we had the vision and the dream of having somebody big to come and inaugurate it. So we had 2 or more, 3 more doctors. So this is, I'm going into the flashback from what you saw. We had 1 small operation theater, a very, very basic microscope, and a Millennium machine. The machine Stellaris you see is one again called for a demo. So that's how we started. Then the team grew. We had some marketing people, added more optoms and counselors. The team grew more again. We added more professional trained people into the team. Now the work grew. In the same small operation theater, we put in 2 tables. From the same operation theater, we were churning more patients. Then we tied up with Dr. Maipal, the Doyen himself, and we became a partner with a part of Center for Sight. And then in 2004, we had 4 eye hospitals in Delhi, and the team was growing. So being early adapters, I think was a good thing that we saw the market, we understood the market. We were the first one in Delhi NCR to switch to electronic medical records. We had professionally trained counselors by professional people. Then we had visiting consultants to build in our retina practice because we did not have enough of subspecialty work with us. We had people come in, visit, and help us build these departments. And slowly the work grew. And then finally we got our own panels. And then we realized that the best way to attract patients is go to your patients yourself. We went to the market to create awareness, give public lectures. We started giving pick-up and drop facilities to all our elderly patients who could not afford or didn't have the means to reach us. We started doing these public connection awareness programs in schools and clinicals. So this is what gave us the brand recognition in the market. This is during the early phase. One thing we realized was that the biggest backbone of any organization is the human resource. So as before I started my talk, I said, human resource, human resource, human resource. It's the team which makes an organization. What you see here is just me. I am the face of SharpSight. There are nearly 1,000 people behind me who have made us reach here. So we started doing this, calling these professionals to train us, do human resource training, technology skill upgradation. We tied up with big politicians to patronize us, probably give us more limelight. I think I'm getting looks from Dr. Partho to close my talk. And this is the price we pay for coming somewhere in the last part of the thing. So I guess I'll close it. But one bottom line is we need as doctors to learn how to build teams, how to have an entrepreneurial mindset, and give patient a delight apart from the clinical treatment and medical treatment we give them. Thank you.
Thank you very much, Kamal. And as a good friend, you've done justice to your talk.